Common and yet tricky key terms related to stomach disorders. For example, acholoridria, the absence of hyaluronic acid linked to pernicious anemia. Acute versus chronic gastritis, the difference between a temporary inflammation and prolonged mucosal damage. The damping syndrome, a critical complication of gastric surgery involving rapid emptying. Helicobacter pylori, H. pylori, the bacterium behind most ulcers and gastritis causes. Hematemesis versus melemma. How to distinguish upper GI bleeding signs. Precious anemia, vitamin B12 deficiency caused by loss of intrinsic factor. Other essential key terms like adenocarcinoma, KM, gastrectomy, gastroenteritis, and peptic ulcer disease. Now we're gonna go in deep in this chapter.
Ever open a med search chapter, see all the bolded terms and feel lost before reading the first line? Key terms are just a small part of the work, but they unlock the rest. If you learn term first, the rest becomes easier to absorb.
Most confusing terms, the tricky ones, those are often mixed up on exam because they sound similar or have subtle differences. For example, gastric ulcer versus duodenal ulcer. The symptoms are opposite. Gastric, its pain gets worse when eating 30 to 60 minutes after meals. Duodenal pain gets better when eating food buffers the acid, but returns 2 to 3 hours later, often at night. Acholoridria, this means the absence of hyaluronic acid. It's confusing because we usually think of stomach issues as having too much acid. However, in severe chronic gastritis or gastric cancer, the acid-producing cells are destroyed, leading to not acid. Erosion versus ulcer. The erosion is a shallow break in the surface layer of the mucosa only. Ulcer is a deeper wound that penetrates through the surface and into the muscle layers, the submucosa. Occult in medicine, this simply means hidden. Occult blood is blood in the stool that you can't see with the naked eye. You need a lab test, fecal occult blood test to detect. So again, acholoridria is the absence of hyaluronic acid in gastric secretions, leading to impaired digestion and increased risk of GI infection. So think about A, absent, chloro, it's the acid, hydria, it's a water fluid, stomach acid, it's missing. And then the duodenal ulcer, open sore in the lining of the duodenum, often caused by H. pylori or NSAIDs. Ulcer in duo means duodenum. Pain improves with food returns later. Also, we have this duodenal ulcer. Then we have the erosions, so it's a superficial loss of the gastric or intestinal mucosal surface. not as deep as ulcers. Like scraping the top layer of skin, here it's stomach lining. So gastric ulcer located in the stomach lining, often worsen with food intake. Gastric is stomach pain right after meals. Occult, so we know it's the hidden or the secret. And ulcer is the open sore on an internal or external surface of the body. Think as a crater, deep, painful tissue loss. Precious anemia. This connects the stomach to the rest of the body. If the stomach lining is damaged, chronic gastritis, it loses the ability to produce intrinsic factor, which is needed to absorb vitamin B12. This leads to anemia. And remember that precious anemia, this is a classic exam topic. It's anemia caused by lack of intrinsic factor. Without intrinsic factor, you can absorb vitamin B12. This is often a complication of chronic gastritis. Related key terms, it's the acholindria, the absence of hyaluronic acid in gastric secretion. This low acid environment is a risk factor for gastric cancer. So adenocarcinoma, it's a malignant tumor originating from glandular epithelial cells, often seen in the stomach lining. So the adeno, it's a gland. Carcinoma, it's cancer. Gland cells turning cancerous. And again, the pernicious anemia is the vitamin B12 deficiency due to lack of intrinsic factor from stomach lining damage. So the pernicious is the sneaky and dangerous, which leads to nerve damage if untreated. Those terms are critical because they relate directly to patient safety. Common diseases you will see in clinicals and key assignments. Hematemesis versus melanoma, those are the viral signs of GI bleeding. You need to react to those immediately. Hematemesis is vomiting, blood, bright red active bleeding, coffee ground old blood. And we have melanoma, black tarry full smelling stools indicating digested blood from the upper GI bleed. This indicates bleeding high up in the GI tract. The dumping syndrome, this is a classic NCLEX and exam topic. It is a complication after stomach surgery where food moves too fast into the small intestine, causing dizziness, sweating, and diarrhea. It requires specific dietary teaching, small frequent meals, no fluid with food. So dumping syndrome, it's a rapid emptying of stomach contents into the small intestine, causing cramping, diarrhea, and hypoglycemia. Food dumping too fast, symptoms hit quickly after eating. The hematemesis, it's the vomiting of blood. Hema means blood, emesis means vomiting. Melena is the black tarry stools due to digested blood from GI bleeding. So melena means black stool from upper GI bleed. Another key term is peptic ulcer disease, PUD, they call it. This is a major disease process involving erosion of the stomach, the gastric, or small intestine duodenal lining. You need to know the risk factor, NSAIDs and H. pylori, and potential complication like perforation. Helicobacter pylori, the H. pylori, this bacterium is the root cause of most ulcers and chronic gastritis. Understanding this changes how you educate patients. It is an infection, not just stress, and why they take antibiotics. So peptic ulcer disease is the erosion of the GI mucosa due to acid and pepsin occurring in the stomach or duodenum. So peptic is the pepsin acid damage, stomach or duodenum source. Another key term is Helicobacter pylori, the H. pylori. This is a spiral-shaped gram-negative bacterium. It is the primary culprit behind chronic gastritis, peptic ulcers, and even gastric cancers. It survives the stomach acid by producing urease. Key terms by disorders. The disorders like gastritis and peptic ulcer. Now let's look at the specific condition caused by inflammation and infection. Gastritis, simply put, this inflammation of the gastritic mucosa is a stomach lining. So gastritis is inflammation of the stomach lining. So gastro is stomach, itis, it's inflammation. Acute gastritis, sudden onset, short duration, hours to days, often caused by irritants like alcohol or NSAIDs. So it's sudden inflammation of the stomach lining, often to infection, NSAIDs, alcohol, or stress. So acute is sudden. Picture the stomach on fire after bad food or heavy drinking. Chronic gastritis is the prolonged, persistent inflammation, usually due to H. pylori. So gastritis, chronic gastritis, long-term inflammation of the stomach lining, often linked to H. pylori or autoimmune condition. Chronic means ongoing, like smothering fire in the stomach continuously. And chronic, it's more than after 3 months, or going more than even 6 months. Atrophic gastritis, a type of chronic gastritis seen in older adults where the stomach lining thins out and loses cell. So this is a chronic inflammation causing thinning of the stomach lining and loss of gastric glands. So atrophy means wasting away, stomach lining gets thin and weak. Gastroenteritis, often called the stomach flu, this involves inflammation of both the stomach and small intestine. It is usually infection, viral, bacterial, and causes vomiting and diarrhea. So food poisoning, stomach flu, both stomach and intestine are affected. Peptic ulcer disease, the PUD. This is the umbrella term for ulcerations in the stomach, the gastric ulcer or the duodenal ulcer. So it's a erosion of a GI mucosa due to acid and pepsin occurring in the stomach or duodenum. Quick tip, duodenal ulcers are more common, about 80%, and pain is often related by eating. Gastric relief by eating. Relief. Um, Gastric ulcers hurt more when you eat. And chyme, this is a mixture of partially digested food and gastric secretion that moves from the stomach into the small intestine. Think of it, it is like digestive soup. Pyloroplasty is a surgical enlargement of the pyloric opening to improve gastric emptying. So pyloro is pylorus and plasty it's reshape or open. So it's a surgical procedure to widen the pylorus. And this image, I think it's beautiful, showing up how it's done. Let's have a recap. What is or what have in common pyloroplasty with Helicobacter pylori? So both pyloroplasty and Helicobacter pylori are related to stomach disorders and their treatments, specifically gastritis and peptic ulcer disease. Helicobacter pylori, the H. pylori, is a bacterium that is a major cause of both chronic gastritis and peptic ulcers. It causes inflammation and damage to the stomach lining. Pyloroplasty is a surgery used to treat complications from the same condition, specifically if the damage from H. pylori, like severe bleeding, or ulcers cannot be fixed with medicine. A pyloroplasty might be performed to widen the opening of the stomach, the pylorus, so it can empty more easily. In short, H. pylori is often the cause of the problem, and the uh, pyloroplasty is a potential surgical solution for the severe complication that can result from it. Um, does the stomach have a pyloric segment, and the bacteria that are there are taking the name? The pylorus, this is the lower part of the stomach that connects to the small intestine. It acts like a valve or gate to let food pass through. So the textbook mentioned that the pyloric glands are found in this area. Helicobacter pylori, this bacterium is indeed named after that body part. Helico means the spiral, referring to its shape. Pylori means the pylorus because its bacterium typically lives in the mucous lining of the stomach, often near to the pylorus. So the name literally describes a spiral bacteria found in the pylorus, and the solution by a surgical that treat this complication. Here are the key terms like a list like I used to do in the past. And here you can see all the key terms chronological alphabetically. Um, you can read them, which I did earlier. So you can just, if you need to write them down, you can just stop the screen. And I pause now and I go. We talk from all these key terms. And we are almost to the end of the chapter here. So this is the way I used to do. Please let me know which one is better, imaging or the list itself. We are at the last key term, urea breath testing. This is the non-invasive invasive diagnostic test used to detect active H. pylori. The patient drinks a solution, and if the bacteria is present, it breaks it down, and we can measure the carbon dioxide in their breath. And these are your essential key terms for chapter 57. Now that we speak the language, join me in the part two where we'll deep into nursing outline of this chapter, the pathophysiology and pharmacology and nursing intervention. I will explain why gastric ulcers hurt when you eat and exactly how PPIs work. Don't forget to like and subscribe for more MedSurg help. Thank you and bye for now.